Another tragic report detailing the death of a second woman who was denied abortion-related care in Texas. Now, earlier this week, we heard the story of Josely Barnica, a 28-year-old mother who died of sepsis in 2021 after being denied an abortion and contracting an infection when she suffered a miscarriage. And now, journalists from ProPublica are telling the story of Nevaeh Crane. In 2023, the 18-year-old suffered a miscarriage on the day of her baby shower, developed sepsis, and was denied emergency care at multiple hospitals before her death. To talk about this story and the reporting that went into it, we're joined now by ProPublica reporter Lizzie Presser. And Lizzie, thank you so much for joining us today.
Thank you so much for having me.
Well, first walk us through your reporting and what you learned about this young woman's death.
So we wrote about Nevaeh Crane. She was 18 years old when she got pregnant with her high school sweetheart, and she had a relatively uncomplicated early pregnancy until her baby shower when she was 6 months along. She woke up nauseous, feverish, she started vomiting, and she had sharp abdominal cramps. She went to one hospital in Beaumont, Baptist hospitals there, and they didn't even take her back. They diagnosed her with strep throat and left her in the waiting room for 4 hours and discharged her. They didn't treat her like a pregnant person at all and evaluate her pregnancy. She went home and she was up again at 3 a.m., waking her mother up in pain. And she went to another hospital, Christus St. Elizabeth. And there her vital signs were alarming and signaled a potential for sepsis. And while the doctors are supposed to treat that with continuous antibiotics and monitoring before discharging someone, they did not. They gave her IV fluids and Tylenol, 1 dose of antibiotics, and though her vital signs had not changed at all or abated, they discharged her again. She goes home and still in pain. She can't walk at this point. She's breathing heavily, moaning, crying with her mother, who's trying to sit by her side and rub her head and keep her comfortable. And she goes to the bathroom and sees that she's bleeding and realizes that this is a miscarriage. By the time they get back to Christus St. Elizabeth, they're rolled right back into a room. She starts getting antibiotics, but the doctors there insist on 2 ultrasounds to confirm fetal demise before offering a DNC to remove the baby, whom she had named Lillian, and hopefully the infection that was in her uterus. But by that point, it was too late to save her. Her sepsis was too far along, and she had developed a bleeding disorder. She died several hours later.
Well, Lizzie, this happened a year ago, and we know tracking data about deaths tied to abortions, it's not really something that Texas does. So how did you learn all this?
So this has been a group effort from the start. When I joined this team, reporters and editors had already been requesting and going through county-level death data from medical examiner offices, flagging anything that looked like it was related to pregnancy. Nevaeh's name came up, and the listed cause of death was just complications of pregnancy. And so as we do for anything that looks like it could possibly be related to reproductive health care, in the state of Texas, we requested an autopsy report. And there we began to see a little bit more of the story. At the very least, what we could see was that she had requested health care several times before dying and hadn't been able to receive it. We still couldn't find the family's phone numbers, weren't able to reach them digitally, and so I ended up flying out and driving over to Candace Fales, Nevaeh's mother's house, and knocking on the front door.
Well, in your article, you talk about in how states with abortion bans, doctors may treat patients like hot potatoes. What did doctors tell you about that and how it impacts care?
That's one of the things that we were really trying to drive home with this article, right? What you can see with a story like Nevaeh's is how quickly a life-threatening illness can set in. 24 hours. That's how long it took from Nevaeh to notice symptoms to when she died. And there is no room for delays. We've been hearing from doctors around the country who are at more prestigious, larger hospitals where they're seeing pregnant patients come in from out of town because their local OBs or their local ER doctors don't want to treat their pretty normal conditions, whether it's miscarriage management or an ectopic pregnancy. They're too afraid, and they're sending them to these hospitals that they perceive to be better resourced. That's something in Texas that we've been hearing about in San Antonio, doctors who are receiving these patients and recognizing how much fear and confusion there is around them. In Nevaeh's case, we'll never know what happened with these doctors. They declined to speak with us. But what we can see is that every little moment of delayed care led to the death of this young girl, right? Without those delays, there's a great possibility that she and her child would still be alive today.
Just a heartbreaking story. Lizzie Presser with ProPublica, thank you so much for joining us.
Thank you so much for featuring this.